Coming up next, we'll explore the different kinds of hormone replacement therapy for women. Stay tuned. Today on Moms Every Day, we are at the Sherman office of Dr. Deanne Strobel talking about hormone replacement therapy. You and I have visited about this before, and this is pretty extensive as far as what you do as a physician to help a woman figure out what is right for her. Let's talk about the types, because there are options out there.
Right, and there's a lot of confusion. A lot of people, physicians included, but patients especially, have a lot of confusion about hormone replacement. They think all hormone replacement is the same. There's a lot of fear about cancer especially. Several years ago, a study came out suggesting an increased risk of cancer with hormone therapy, and millions of women,
I remember that one.
Yes, millions of women stopped their hormone replacement. The problem is that study is true, but it's related to that particular hormone. So it's mainly synthetic hormones which mimic the actions of natural hormones. So the studies that were done that showed an increased risk of cancer, stroke, blood clot, those were not the same as the risk of bioidentical hormones.
Okay.
So now most of the studies on bioidentical hormones are not sponsored necessarily in the United States. So a lot of the studies we have to go into Australia, Europe, Canada to find that information. And we do not find an increased risk of cancer, blood clot, and stroke in bioidentical hormones.
So with the bioidentical hormones, are there different ways that they are administered?
Yes. Now, there are some patients that can receive oral bioidentical hormones, but not all of the different hormones can be given orally. Some of them are processed by the body and just made inactive, so that is why we cannot always give them orally.
Okay, so what are the options?
So a lot of times we have to do prescription creams that are made for the individual patient, or subcutaneous hormone pellets.
How does that work?
Well, the hormone pellets are given in, are put underneath the skin. So we have to give a small amount of a local anesthetic and make a small incision, and then the pellets are placed there. The nice thing about the pellet therapy is that they are delivered continuously, and that will mimic normal ovarian function.
And how long do they last? Are you going in monthly for this?
No,
or,
they usually last about 4 months in most healthy women.
Okay, all right. Thank you for the information. Appreciate it. I'm Ellen Sacco. Be sure to check out our website, momseveryday.com/Texoma.